Transportation from United Way of Connecticut 211. Thank you so much for tuning in to the webinar this morning. We are going to get started, and if other folks come in a little bit later, that's quite all right. Thanks for the individuals who helped me quickly a moment ago, making sure our sound was good to go. So the webinar this morning is going to be in a listen-only mode. So all of you will be able to, of course, hear me and follow along as I go through our website. But at the end, I will save about 5 minutes for questions in case folks have them. And when you do, I'll come back in here to the webinar software and you can chat, type in your question, and then I will read the question and provide an answer. So I'm very grateful to have this opportunity to talk to all of you today, and I appreciate you registering. We've offered 2 of these webinars already around transportation. This is our 3rd and final webinar for transportation. However, we are doing a lot of webinars here at 211 on various subjects, on how to use our website, on how to use a few of our specialized tools here. So if you're interested in a webinar after today, for yourself, your staff, other organizations in your community that you may feel would benefit from a webinar on 211, here is my contact information. Please feel free to reach out for any inquiries around scheduling a webinar or presentation. I'm our lead resource specialist and project manager, and here's my phone number and email. So to get started, I just want to mention that the State Department of Transportation does support this effort to provide information through outreach and webinars to increase the awareness around resources for transportation. This is a big need that we see when we run statistical data. I'll show you some reports in just a moment around transportation resources and calls that we get of that nature. So DOT does support this effort, and we again have provided a few webinars already. This is our final one, and we are tracking the referrals and the needs around transportation. So I'm going to give a brief overview of who we are, what we do. I'm going to jump right into a live demo of our website and show you a few of our specialized tools and reports, and then at the end we'll save some time for questions. So for those of you who may not have awareness of 211, we are the state's 24-hour, 7-day-a-week information center for health and human service referrals and information, which of course includes transportation options and programs. We've been around since 1976. So we actually started regionally around Connecticut as Infoline, which some of you who've been in the field a long time may remember. And then in 1999, we became the first state to adopt the 211 calling number. So we are available 24/7. We are what are known as a blended contact center. So we provide information and referral to health and human services, but also crisis intervention and suicide prevention. We serve as a central intake point for housing, as well as EMPS, or Emergency Mobile Psychiatric Services for youth and adolescents. We are a program of the United Way of Connecticut. So under that umbrella, there are other various departments here in our offices in Rocky Hill, including 211 Child Care, Child Development Infoline, or CDI, Care for Kids, and I mentioned earlier our housing unit. So without further ado, I'm going to go right into a new report that we just put out, so that all of you can see some statistical information around transportation needs statewide. So we're here on our public website, www.211ct.org. I'm going to walk you through how to locate this report and speak to it for a few moments, and then we're going to go into more of a live demo of the resources on the website. But from the top of our homepage at Professionals, if you choose that tab, there's a lot of options that you have on this page. We're going to go right to Reports over here on the right column. And then you'll see here a few options under the 211 Barometer. This is our newest report, so specific to transportation needs. And in your spare time, you can certainly read all the details of this. I don't have time today to dive too deeply into it, but I did just want to show you a few of the graphs with some statistical data in it, pardon the scrolling. So we're going to go right to page 3 here. So here are the top 10 transportation requests that we received in 2016. So you're going to see the number of requests and then the percentage of those that were unmet. So I'm going to speak to that for just a moment. Overall in 2016, the most common transportation requests were for medical appointments transportation, disability-related transportation, local bus service, and senior ride programs. So a total of 3,649 service requests. Of those, 83% of the callers were successfully referred to programs and services, while 17% total of requests were unmet. So you can see the breakdown of that on this particular chart. And just to explain what unmet really does mean, so a service is classified as unmet when our 211 contact specialist is unable to refer a caller to a program or a service that satisfies their need. The most common reason for an unmet transportation service request was that there was no program found to meet the caller's need. In fact, of the 619 unmet service requests in 2016, 333 of those, so 54%, were unmet because there was no program available. So bringing all of this to your attention so that you can think about the transportation options that you know are available in your community, but perhaps other options that you know are available that may not be listed in our 211 database, that may not be well known in the community. So really our role is trying to obtain more information about transportation services so that we have more options to refer people to, and then so that you as providers can really stay connected to what is new in the community and help us sort of fill in the blanks so that we can decrease the number of unmet needs. I'm just going to scroll a little bit farther and show you a snapshot of the top 10 transportation searches on our website. So somewhat similar to the graph above, but you can see the breakdown for the whole year as to how many hits we got to our website for these specific service requests. Okay, so I'm going to go back onto our live website here from our homepage. So since 2015, August of 2015, we've made a lot of enhancements to our public website. I hope that some of you have had the opportunity to use it, but if not, today will be a brief overview for you, and then I definitely will empower you to use it when you can to help the clients that you're working with in the community. Very quickly, I'll show you a few quick searches and features off the website. So just know that the entire website can be translated into any one of these languages. So the globe at the top right of the home page, if you drop it down, excuse me, there's various options for languages. I'm going to choose Simplified Chinese. And you see the entire site does translate over. If you scroll down, you'll see that that'll carry into the searches. If we were to click on one of our service categories, it would carry into the search. Scrolling back to the top and choosing Show Original will get you back into English. This entire site is mobile friendly and location aware if you want it to be. So what that means is if you're on your phone, this site is completely compatible to a phone, a PC, a tablet, whatever you're using. Down slowly, going to scroll to the bottom of the page here. About midway are a few links to the other specialized services I mentioned briefly at the top of the presentation: Child Development Info Line, Child Care, EMPS services, and housing. Scrolling all the way to the bottom, we also have a 211 navigator. Very quickly, I'll just show you that this is an online benefits screener that we created here in-house at the United Way of Connecticut 211. It assesses eligibility for all of these programs, mostly state and federal benefit assistance programs. It's a very non-intimidating form, so no social security numbers or birthdays required. Just a basic screener on household size, demographics, household income. Once you hit submit, it will tell you which of the programs you may qualify for. So if this is something that would be useful if you're assisting people to really get a better sense up front if they may or may not be eligible, we really encourage you to use this 211 navigator. So I'm going to scroll back up to the top. I'm going to show you a few ways that you can search our website. I'm going to just bypass the first one for a moment. I'm going to scroll right here to unsure of what you're looking for, Let Us Help. If you click Let Us Help and then move to the drop down, you're going to see statements based upon need. So when callers contact us here at 211 and our contact specialists say 211, how may I help you? The person on the other line is going to say something very similar to these statements. I need to find a job. I need food. I need transportation. So we wanted to create this list as a more user-friendly option and a more common language option for people who knew what they needed but maybe didn't know the specific program names or agency names in our database. Our database contains 4,000 agencies and 40,000 programs and services. So it is a very large database. So we wanted to provide various options for people in the hopes that they would get into the system, know what they were looking for, and find what they were looking for easily. So I'm just going to choose I need transportation. I'm going to click continue. It's going to ask where I am or where I'm looking for help. In this section, you can put in a zip code, a city, a town, or even an address. I'm just going to put in Hartford. Default to Connecticut, so serving all of Connecticut. I'm going to choose continue. What this does, because it is one of those need statements, it pulls in any option that we have coded with a transportation taxonomy term. So just a quick glance here, there's 35 resources serving Hartford. And if I scroll down, you're just going to see we notice Dial-A-Ride, we notice some of the Ryan White transportation, the transit districts. So you're getting a very general overview of all of the potential options that you might need related to transportation. So there's other ways to narrow this down. So I just wanted to show you that option first. I'm going to go back to our home page. The second option that you can utilize is our categories. So up here at the home page are a few options, transportation being one of them. I'm just going to choose more categories so that you can see the full scope of every category we list. And then I will choose transportation. The links that you're going to see here in the categories, these are not every single link related to transportation, but it's a snapshot of some of the options that we have. I do like to say it's sort of getting your foot in the door with the database. So starting the search off with a few suggested searches here. So disability-related transportation, family prison visitation support, some transit options in the center column. And then on the right is our suggested reading, which I'll talk to in just a few moments. These are our Elibrary papers. But what I'll do is I will take one of these searches, medical appointments, transportation, and choose it, just to illustrate that when you go from the category, the default for the search is Connecticut. So it's serving the entire state. But from here, you can change this search at any time. I'm going to put in a zip code this time. Powered by Google, so on this page you're going to see it's going to suggest Middletown, and that's what I want. We started 168 resources statewide, and when we search it for Middletown, it's going to narrow it to 17 for medical appointments, transportation, serving Middletown. The other nice thing about our website now is that there are suggested terms. So you may also be interested in ride sharing. You may also be interested in local bus service resources. If we were to click on any one of these, it would re-up the search and give you a list for that particular service request. I'm going to stay here for just a second, and I'm going to show you a few other features of our website. So if we scroll down, we see the total of 17. If we look to the right, all of these pins on the map correspond to all of these 17 resources on the left. So if we were to choose one of the options here and clicked on it, it's going to get us right over to the Road to Recovery through the American Cancer Society. If you were on your phone, you could quick call this agency, view their website, or get directions, either from the pin or from the column on the left. So let's say that this option was a good option for you, for someone you may have been working with who is a cancer patient and needs transportation to treatment. You wanted to share this resource or print it. This button right here, from one resource, you can print it or share it. So it gives you the full printout. You can share it by an email, or you can share it by a text message. You just have to put in the telephone number and choose the cell phone provider. And then once you hit send, this one resource will go right to that person's cell phone or email, depending on what you've chosen. If we look at the details of the program, you're going to see everything that's needed in terms of how someone needs to apply for the service, if there is a cost associated with it, the number to call, the hours of operation. But let's say you work for the Cancer Society and you notice that we have wrong information. Well, how would you update with us? Right here, from any detail of any record in our database is a report update button. This is a very important feature for me. I work in the information services department, and so myself and my team, we are a team of 5 full-time staff. We maintain this database, and we're constantly in there updating records, changing information. This update button here, when you fill it out and hit submit, comes right into my department, and myself and my team act on these as quickly as we can. Our goal is to keep this database as current and updated and correct as we possibly can. So you'll see on this form, it presets it to the agency you've looked at and the program you've looked at. Just fill in your name, your email, your phone number, and a description of the update, and we will take care of it. Now, this is appropriate for anyone, so anyone in the general public can also use this update. Our call specialists through the call center, callers report things back to us all the time. They go to a food pantry and the door was locked and the hours posted were incorrect, so we act on those, we call the food pantry, we change that information. So it's the same concept here on our website. Anyone can report this update. If we see that it's not coming from the agency provider, so by the phone number or the email, we will of course do our research and reach out, but we encourage anyone to use this functionality. All right, so I'm going to go back to the results list here. So we did medical appointments, transportation, serving Middletown with 17 resources. Let's say you're working with someone and you're looking at a few of these together and you notice there's a bunch of these on the list that really do seem appropriate. Why don't we start to build up a resource cart? So right here, add to cart is a new function for us. We scroll down, I'm going to add a few. So we're all used to this functionality when we shop online. The benefit of our cart is that it is totally free. You will never have to pay anything for adding resources and sharing resources to the cart here from our website. So I'm going to add 3 resources. You'll see at the bottom this widget here, My Resource Cart is populated with 3. If we choose this, you're going to see the 3 options that you have entered. You can remove any of them at any time. From here, you can print and share this entire cart. The only limitation of the cart is that you can't text it. So as I mentioned before, one resource can be sent by text. An entire cart can be printed or shared by email as you see fit. Okay? And then back to the last search. We do have some advanced filtering capabilities. You can filter results by target population. So we have certain terms targeted for Medicaid recipients, veterans, substance abusers. I'll show you that search in a moment, but just very quickly, you can also filter by radius. You can filter by whether a resource is open now or not, by day of the week, by gender, which comes into play for shelters and sober living homes, or by an age bracket. So I'm actually going to filter by a target population. I'm going to choose veterans. So you're working with a veteran who needs a medical transportation option. You have Middletown, you have your target. We're going to filter results here, this yellow bar. So we started with 17, and now we have broken it down to just 2 resources. So a much more manageable list of options if you're working with someone who is a veteran who needs this service. Okay? All right, I'm going to go back to the home page one more time. And just know what I'm going to show you next is also available from this place here, this search box from the results list. Same exact functionality. I'm just going to go back to the home page to show you. I'm going to clear out Middletown. And again, the default is always Connecticut if you don't put in a geographic location. I'm going to just start typing the word ride and show you that there's a few options that come up: ride sharing, community ride programs, senior ride programs. When you start typing in a word or phrase here, there will be auto-suggested terms. These are our taxonomy terms. You can use them, but you don't have to. I'm going to also just illustrate transportation. A lot of different options with the word transportation in it. Transportation expense assistance, Mercy transportation, workers needing transportation. Okay, I'm just going to choose disability-related transportation. I'm going to do the full search here for Connecticut. just so that you can see the scope. 127 resources coming up, mostly linked to city and town offices, but also other transportation providers. Let's say you knew of a particular program name. So I'm going to clear this out right here. I cleared away disability-related transportation. You know that Logisticare is the transportation provider for Medicaid recipients. It doesn't auto-suggest, which it will not, if it's a program name or an agency name, but you can still look it up. If it's spelled correctly, when you click search, it's going to return the results. So here we go. One resource, medical transport for Husky A, C, and D recipients at Logisticare. More details shows you the breakdown of information and all the necessary information that you would need if you were giving someone this referral. Okay? All right, so I showed you a few ways to look up information. I'm going to go back to our professionals page. So let's say you run a program, but you want to see if you're in our database or not, and you try, and maybe you don't find it. Okay? I hope that you're able to find it if you are, in fact, in the system. But let's say you don't, for the sake of example. We're going to go to the professionals page here. If you do not find your resource in the database, or you want to add potentially a new resource to your organization record or profile in our database, on the professionals page, we do have a few ways you can do that. If you can't find your listing on the web, you can click here and go to our update form. All right, so this is exactly what we looked at when we hit the report update button, but this is just a blank version. Okay, so you can fill this out and tell us, you know, you didn't find yourself, you think you might be in there, or maybe you know you're not in there and you want to be. That's one option. The other option is we have a full link here for nonprofit entity with multiple programs and services. This is a full, long intake form if it's a brand new organization and you want to add us into the system. Again, when you hit submit, these come into my department and we act on these very quickly and we'll follow up with you accordingly. All right, so from the professionals page, that is how you would take care of doing that type of an update with us. The other thing I wanted to show you, I'm just going to remind you from when I started here, on the reports button, we'll get you to the 211 barometer that I referenced at the beginning. I'm also going to show you our 211 Counts website, also on our professionals page. 211 Counts is an online data dashboard of information. I don't have enough time to do too many searches on this, so I will say that if you want further training on the 211 Counts, if you'd like a webinar on 211 Counts, I'm happy to accommodate those requests. There's a lot of data here. All of the data is populated from the call referrals that we are making through 211. The data goes as far back as March of 2014, and there's various filtering capabilities. So you can filter by zip code, county, congressional district, House district, Senate district, or region of Connecticut. You can narrow it by a specific time range, a custom date range, the last 30 days, the last year. This is really great for folks who may need to present information to their local representatives, or if you're applying for a grant and you need statistical data, this is a great tool to use. You can display the data by percentage, you can display it by count, and then you'll also see the unmet needs category, which should look familiar to what we looked at the beginning off of the barometer. You'll be able to see where there are gaps in services. So rent assistance is also a big request for us, and you'll see that 76% of those requests are unmet because there are a lack of resources for rent currently. So transportation assistance, if you hover over that, you'll see a very brief description of what those options entail, which is everything that we have talked about this morning. Okay, so that was 211 Counts. I'm going to go back to our website very quickly. One last thing I'd like to show you is our Elibrary. So Elibrary is at the top navigation bar. We have about 400 papers currently. These have been in development for many years. They started as a tool for our call specialists, and now they really have evolved to become a great web tool for folks that are using our website. So we do have multiple categories. We'll choose transportation, and we'll just take a look at one of the papers here, adaptive driver training. So generally they're very brief and concise, usually about a page, no more than 2 or 3 pages. They can be exported into a PDF and printed, but all of the papers when viewed electronically will allow you to link to the source that we're getting this information from. So in this case, the Connecticut Bureau of Rehabilitative Services. We scroll down farther. There's information about Connecticut non-driver ID, so there's a link back to that resource. And then scrolling further, this will also link you back into our database. So what we were just looking at. So adaptive driver training resources statewide. There are just a few, but they're in there. So really it's one-stop shopping. You're going to continue to stay linked into our database, to some external resources, and we hope that it's user-friendly for you and really keeping these resources right at your fingertips. So in closing, I will say that we do encourage all of you to check your profiles or to get a hold of me, and we can walk through that together, and I can send you a printout of a Word document of what your information looks like in the database. My team works really hard to stay connected to the providers in the database, so we really encourage you to update with us as you need to, so that, again, we don't have this high percentage of unmet needs. We can really provide adequate referrals based on the area that the caller is reaching out from, and also for the folks that are viewing our website and looking up this information. So I'm going to go back into the software, and I'm going to pause for just a moment to see if anyone may have any questions or comments. I'm going to just take a quick pause. So if anybody has a question, if you would kindly just chat that into the box there, and I'm happy to read the question out to the group and then answer accordingly. Okay, so it looks like we have no questions. I'm going to just show you one more thing on our Elibrary since I have just a moment. So we looked at the transportation category, but I did want you to know that there are other categories that may be of interest to the folks you're serving. So older adult programs has a fairly comprehensive list of programs serving that population, including some of the transportation options. So there is some overlap here. And then disability-related services, which will give you the comprehensive list of those papers. So it's taking a moment to load. There we go. And again, some of the crossover here with some of the transportation options as well. All right. So I'll throw out my contact information one more time. I thank you all for joining this morning. I hope that the webinar was informative. If you have questions after we close down the webinar, please feel free to reach out to me by phone or email, and it was certainly a pleasure to be able to speak to you this morning. So thank you again for tuning in, and I hope everyone has a wonderful day and a wonderful holiday. Thank you.